Hi, Higher Health community. This is our third team town hall. It's
Fourth.
Is it our fourth?
Yeah, I'm pretty sure.
I thought it was our third. Anyways, that just goes to show the days are like groundhogging together.
Yeah.
It's a bit of a partial team town hall because there's Dr. Von Hagen and Dr. Campbell and myself today. And we were powwowing about what topic we wanted to bring to the forefront to our community today. And we decided we would spotlight children's health, pediatrics. So, and we can talk about it in the context of what we are hearing from our parents of pediatric patients, or what we hear about commonly in our visits. So who would like to start the topic?
Oh gosh. Well, let's just go into what kids are feeling, what parents are noticing their kids are going through this crazy transition, changes in school, camp, summer. I guess maybe Dr. Walker, why don't you start just with what you're noticing with your kids at home? They're a little older.
Okay. So yeah, in my direct environment, so I have two boys, one who just turned 10 and one who's about to turn 8. And there's been a lot of behavioral regression. That would be like the medical term, I think, to describe what I'm observing, because they can't get their wiggles out like they used to as far as expression with their peers. And they can see their friends on Zoom and FaceTime, and they've seen like them 6 feet apart in the street. But it's not the same, because like children have that need for bonding with educators, bonding with people, bonding with their friends, and that's been removed. And so in our house, there's a lot of irritability. These two little beings are way more irritable, where before they would be a lot more even keel. And I've heard from other clients who have children in, early childhood, middle childhood, that they're seeing a lot more bedwetting, a lot more urinary accidents. So children that have been toilet trained forever, now having accidents. And they show their stress in different ways than adults do. So that's what I've been seeing in my house.
Mm-hmm. And so how are you managing that at home?
So I give my kids a lot more runway than I used to. So behaviors that I used to clamp down on right away as being inappropriate or not serving them, I now let them have their moment. They need to get that out. They don't have the vocabulary or the linguistic skills, even though they're 10 and 8, to say, I feel. They don't have that. And they're boys. So they need to show. That's how they show how they feel, is by like the illustration of their emotions. So a lot more patience and a lot more, okay, you need to eject from the situation, go outside to the backyard, or go ride your bike around the block 5 times, come back and tell me how you feel now, or see how yourself is sorted out. And then there's a lot more dialogue. There's a colleague of ours, Dr. Jen Forrestal. She's a naturopath in Waterloo. And she's developed something called the Umbrella Project, which has been around for about the last 5 years, I believe. And it is a great website that has tools about how to talk to your kids, and worksheets about the color of their umbrella. And she's really focused her practice on pediatric mental health. And I went to a seminar on it like last April, and it was really great. So I've been incorporating a lot more of her dialogue points on with my own children.
Cool. That's a great tool. We'll type that in the comments. Dr. Laura, what are you seeing in terms of clients with kids and recommendations that are common these days?
Yeah, I can definitely echo everything that Dr. Lindsey Walker is saying. And I say especially that sort of kids are really wound up, right? They don't have recess, they can't go to the playground, they can't have time just seeing kids running around. And so I think this is a good chance to kind of add some structure in kids' lives. I find kids really thrive on routine, and they like to kind of know what's happening. That's why daycares, preschool schools have such strong routines, because kids enjoy knowing what's coming next. They don't love that unpredictability. And so I think adding some predictability of okay, you know, tomorrow morning it's playtime outside and you're going to go for a walk in nature, and then trying to eat your meals at the same time, trying to include a favorite food, trying to get kids involved in maybe in the kitchen and cooking more. And so having a little bit of a sense of normalcy and that routine, kids will really thrive on that and they'll look forward to that. And if you can get that back in their life, you might notice that maybe some of these other outbursts or behaviors go away because they feel a little bit more like themselves and a bit more grounded. And so I think more than anything, get outside and spend some time in nature, get your vitamin D, and find a routine that works for you and your family.
I think we all like the routine.
Oh, sure.
Yeah, we you know, kids and parents who get us all on camp routines, right? Like,
yeah.
It's lunchtime now. Now it's, what is it? The
Rest hour.
The siesta. Yeah. The rest.
Yeah.
Yeah. It was funny. I was just telling my mom watches Ellie 3 days a week, and we're trying to get Ellie on a routine, and my mom just, it's like we have the mentality we have to take her out and tire her out so that she'll sleep, but then she gets overtired. So it's now, no, mom, like you have to lie with her for 2 hours, like it's rest hour. And we have to train her that these are the times. So
what have you seen at home with Ellie? So Ellie's like really in the toddler zone, so it's a different place to be.
Yeah. So, I mean, it hasn't, the only thing I've really noticed is she really misses that social connection. So she's running after kids when she sees them. And I feel sad that, you know, we were into all the music classes and social outings and then it just cut. So I wonder how she interprets that, but you know, maybe she doesn't notice anything, and she definitely gets a lot of time with us. But yeah, I find the whole computer socialization and watching, at first, you know, we were part of online music classes and it just didn't work. So I can imagine for your kids too, it's like sucking into the computer and it's just not the same. There's not the same connection there. So
definitely.
Yeah. So I hope that, I don't know how socialization will evolve from here, but I hope that kids are back to camp this summer, and I hope that their classes will resume, you know? So
yeah, it's we'll just have to wait and see as it unfolds. Right now, let's hope that it'll be a blip in our society for what we needed to do to get the job done, and then things will evolve to more normal routines. Yeah.
So if we could say one key recommendation, I know we've said a few here, like just share what you're recommending a lot in practice for what you see. And maybe I'll start and I'll say it super quick. I see a lot of anxiety, children's anxiety, and also it's normal to be anxious. So you just want to have the tools to kids to know what to do when they're feeling feeling like that. And maybe, so one strategy I do is educate on magnesium and GABA, which are easy for kids to take. And, you know, magnesium can go in liquid, and GABA, there's chewables. And then, you know, like Dr. Walker, you said they have a hard time saying I feel, but maybe they can make the connection of I would like some GABA right now, you know, or it's just a connection to knowing they're agitated, but having a few more words to it, or they're going to bed at night and they get trained that this is sleep time. So to help calm your nervous system, I mean, it's hard to say it super quickly here. I know we have to go, but those are two of my favorite recommendations for pediatrics. So Laura, you have to go sooner. So do you want to say anything from your end for pediatrics?
Yeah, I mean, with me in pediatrics, it's really simple. It's exercise and being outside, especially from all my previous training running summer kids for camp. They just really thrive when they can be in nature. And now that the weather's getting nicer, finding a park where you can maintain physical distancing and be with your family and go on a bike ride and get outside. I think exercise is so important for our mental health. And with kids, it can just be unstructured play and just being outdoors. And so that's the one thing I would say to add in with your family. Wherever you can find it, morning, evening, midday, get them that walk or bike ride.
I love how you did pedal heads and like entrepreneurship all through school. It's
Yeah.
teaching kids how to bike. So yeah.
Yeah. That's my secret, what do you call that, I guess? My secret skill is I'm really good at teaching kids how to bike. If I wasn't an ND, I could make a career out of teaching kids how to ride bikes.
I didn't know that about you, Laura, that you were a Pedalhead like ambassador.
Yeah.
Didn't know.
Yeah. Site manager and head staff trainer for 7 years. And
Oh my God.
taught thousands of kids how to ride a bike. So like I said, and I was really good at it. So that's my little secret skill that you all know about me now.
That's awesome.
That is so wonderful.
Yeah.
Mm-hmm.
Okay, so my tip. Okay, so I've been hearing a lot about bowel changes in my pediatric clients, specifically constipation. It is difficult to keep any healthy child free of constipation. So now that things have shifted in their life, one of the only things they have control over right now is what they take in and what they put out, and if they hold their stool or not. So obviously there's some diet strategies we use, increasing clear fluids. Sometimes we have to move to using some very gentle laxatives, osmotic laxatives, which can help just reset things. And then, clear the kid out and get them back on track with fiber and water and probiotics and different things. And, in pediatric medicine, abdominal pain is like a constant thing that children bring up. And sometimes the abdominal pain is organic. It comes from a medical cause, but other times it's psychological. And that we find that a lot, that they actually have something they need to unpack emotionally, and that's what's causing the tummy pain at night and leading to insomnia. So I've been navigating in my professional life over the last 3 months a lot of constipation in children who were not previously constipated or maybe struggled with that before. But there are lots of interventions to keep your child free of constipation so that they can move their bowels with ease. I think we all know if we move our bowels with ease, we're all living with more ease, because being constipated is not a good time at any time. So I think that would be my tidbit share for today.
Awesome.
Love it.
Well, so we really would love any pediatric questions. We've barely scratched the surface here. And so maybe we'll be posting this in our community page. For anybody who watches this, if you post a question on pediatric health, we'll respond further there. So thanks, guys. I love zooming in with you for these little town halls and connection as we resume our previous connection.
Yeah, exactly.
Mm-hmm.
Oh, yeah.
All right. Well, enjoy this beautiful day, and we'll chat next week.
Until the next
everyone.
Teen Town Hall.
Yeah.
Yeah.
Bye. Bye, everyone.